Imagine a cancer so deadly it claims more lives every single year than breast cancer, yet most people barely hear about it until it's too late. What if the next few minutes could arm you with knowledge that saves a life, yours or someone you love, by helping you spot hidden warning signs almost everyone ignores? Pancreatic cancer is medicine's toughest silent killer, with a 5-year survival rate stuck at around 13% according to the latest 2026 reports from the American Cancer Society, up slightly from the often cited 11%. But still heartbreakingly low. This stealthy disease strikes more than 67,000 Americans annually, quietly climbing the ranks to become one of the top causes of cancer deaths. Studies show that a staggering 75% of patients miss or dismiss their symptoms until the cancer has already spread far, making early action feel almost impossible. The real shock: many of those very same clues start appearing months, sometimes way earlier, before any doctor visit. Hiding in plain sight in your daily life. Deep inside your abdomen sits your pancreas, a hard-working organ about the size of your hand, relentlessly producing the hormones and enzymes that keep digestion and blood sugar in balance. Its hidden position makes it incredibly hard to examine or catch problems early, which is exactly why recognizing subtle changes can be a game changer. Today we're breaking down 8 surprising symptoms that could signal pancreatic cancer, some so ordinary you might be feeling them right now without realizing the danger. Even better, groundbreaking research from Johns Hopkins shows that noticing just 3 of these together can skyrocket your chances of catching it early, by up to 68%. Important disclaimer: this is purely educational content meant to raise awareness, not medical advice, diagnosis, or treatment. If anything here concerns your health, please see a qualified doctor immediately for professional evaluation. All facts here come from verified, reliable sources. Check the links in the description for full references. If this hits home or opens your eyes, hit that like button, subscribe, and turn on notifications for more life-saving health insights. Let's jump right in and uncover these 8 red flags together. Symptom 1. Urine that turns dark yellow or brown. Your urine color can serve as a surprisingly powerful indicator of underlying health issues. When pancreatic cancer begins to grow, it frequently compresses or blocks the bile duct, which sets the stage for jaundice to develop. Jaundice happens because bilirubin, a yellow pigment released as red blood cells naturally break down, starts accumulating in high levels throughout the body. In a healthy system, the liver filters this bilirubin out of the blood and directs it into bile, which then passes into the intestines and gives stool its characteristic brown color. However, a pancreatic tumor that obstructs the bile duct disrupts this entire pathway. Even when you're drinking plenty of water and staying properly hydrated, your urine can shift to a noticeably darker shade, deep yellow, amber, or even brownish, often looking very similar to cola, dark tea, or strong coffee. This darkening occurs because the body reroutes the excess bilirubin, pushing it out through the kidneys as an alternative elimination route. Far too often, people dismiss this change, assuming it's simply from dehydration, certain foods, supplements, or recent dietary adjustments. But if the unusual color persists for more than a few days despite good fluid intake and no clear explanation, it is a strong reason to seek medical attention without delay. Importantly, this urine color change can frequently appear as one of the earliest clues, sometimes long before more visible jaundice signs, like yellowing of the skin or the whites of the eyes, become obvious. Paying attention to this subtle but significant early warning could make a real difference in catching the disease sooner. Symptom 2. Pain in the abdomen or back. The specific location and nature of pain linked to pancreatic cancer can provide doctors with important clues about exactly where the tumor is located. When the cancer develops in the body or tail of the pancreas, many patients describe a unique and persistent type of discomfort that grows increasingly hard to ignore. Imagine a dull, deep-seated ache that feels like it's originating from far inside your upper abdomen and refuses to go away. This pain very commonly radiates through to the back, often creating the unmistakable sensation of a tight band wrapped around the middle of your body. Unlike everyday stomach upset or typical indigestion, this discomfort usually worsens noticeably after you eat a meal or when you lie flat on your back. The pancreas is nestled in a complex web of nerves, blood vessels, and nearby organs, making it especially sensitive to any pressure or invasion. As the tumor enlarges, it presses against or irritates these surrounding structures, triggering persistent and often intense pain signals. Some people describe the feeling as a continuous gnawing or boring sensation, while others experience it as an unrelenting, heavy pressure deep within the torso. The way the pain evolves is particularly telling. At first it may come and go in episodes, but as the condition advances, it tends to become more constant, more severe, and much harder to relieve. Recognizing these specific pain characteristics, its timing, exact location, radiation pattern, and quality, gives healthcare providers crucial diagnostic information. These details help them differentiate pancreatic cancer from more common causes of abdominal or back pain and guide appropriate testing. Symptom 3. Persistent bloating or unusual feeling of fullness. Pancreatic cancer has a way of quietly disrupting your digestive comfort in ways that catch most people by surprise. As the tumor continues to grow, it interferes with the pancreas's normal ability to support healthy digestion, often leading to strange sensations of excessive fullness and ongoing abdominal bloating. The pancreas normally releases specialized enzymes that break down the proteins, fats, and carbohydrates in every meal you eat. When cancer damages this process or physically blocks the release of those enzymes, you may suddenly find yourself feeling completely full or satisfied after eating only a small amount of food. This is medically known as early satiety. In many cases, the growing mass simply presses directly against the stomach or the nearby small intestine, preventing them from expanding properly during meals. The bloating tied to pancreatic cancer feels distinctly different from routine gas, indigestion, or occasional overeating. It tends to be stubborn and long-lasting, rarely responding well to standard remedies like antacids, simethicone, peppermint tea, or simple changes in what you eat. Your abdomen can feel noticeably distended, tight, or swollen, even on days when you've barely eaten anything substantial. The discomfort often peaks right after meals, but for many people it lingers throughout the entire day without much relief. This isn't just an annoying inconvenience, it's your body's clear signal that something deeper is wrong with your digestive system. At first, a lot of individuals chalk these symptoms up to common digestive quirks, food sensitivities, aging, or daily stress. However, when the bloating and early fullness continue steadily for weeks without any obvious trigger or improvement, it's time to consult a doctor for a thorough evaluation. Symptom 4. Enlarged gallbladder or liver. When pancreatic cancer progresses, it frequently triggers a chain reaction that affects neighboring organs, with the gallbladder and liver being especially vulnerable. These changes usually stem from the tumor blocking or compressing the common bile duct, the main pathway that carries bile from the liver into the small intestine for digestion. The gallbladder, normally a small, pear-shaped pouch, can become noticeably enlarged and distended when bile can no longer flow out freely. It keeps producing and storing bile as usual, but with the exit route obstructed, pressure builds inside and causes the organ to swell significantly. In much the same way, bile can back up into the liver itself, leading to liver enlargement or swelling from accumulated fluid. During a careful physical exam, doctors may sometimes feel this as a firm, palpable mass or bulge located under the right rib cage. Modern diagnostic imaging, particularly ultrasound and CT scans, can detect these abnormalities very clearly and provide detailed confirmation. The organs in this upper abdominal region are tightly interconnected through shared ducts, blood vessels, and nerve networks. When one part of the system is compromised, it often creates a ripple or domino effect that impacts the function of the others. Understanding these close anatomical and functional relationships helps physicians piece together the full diagnostic picture more accurately. For this reason, healthcare providers routinely check for any signs of gallbladder or liver enlargement during physical examinations and follow-up visits, because such findings can serve as important red flags pointing toward an underlying pancreatic issue. Symptom 5. Blood clots. One of the most commonly overlooked dangers linked to pancreatic cancer is its powerful effect on how the body handles blood clotting. This form of cancer can trigger a condition called hypercoagulability, where the blood becomes unusually prone to forming clots, particularly inside the deep veins. Deep vein thrombosis, or DVT, most often appears in the legs, causing the affected area to swell, feel unusually warm, and turn red or discolored. The risk escalates dramatically if part of the clot breaks free and travels through the bloodstream to the lungs, resulting in a pulmonary embolism, a truly life-threatening emergency. These clots tend to form because pancreatic tumors release inflammatory chemicals and other substances directly into the circulation. Those compounds throw off the delicate balance of the body's natural clotting system, creating the ideal conditions for dangerous clots to develop. Warning signs of a pulmonary embolism include sudden difficulty breathing, sharp chest pain that gets worse whenever you take a deep breath, and a noticeably rapid or pounding heartbeat. Any of these symptoms require immediate emergency medical care, as they can quickly become fatal without prompt treatment. Symptom 6. Fever and shivering, chills. Fever episodes in pancreatic cancer are typically the body's immune system reacting to the persistent inflammation caused by the disease. When the pancreas becomes inflamed due to the tumor, it sets off the natural defense mechanisms of the immune response. These temperature fluctuations can be especially confusing because they usually come and go rather than staying steady. You might suddenly feel intensely cold with violent shivering and chills, only for that to shift quickly into spikes of high fever. This pattern stands out from the consistent, unbroken fever most people associate with everyday bacterial or viral infections. The combination of jaundice, from bile duct blockage, and active pancreatic inflammation creates what can feel like a perfect storm for irregular and recurring temperature swings. At the same time, the body is fighting on multiple fronts, dealing with obstructed bile flow, ongoing inflammation, and the cancer itself. When these fevers strike, they are often joined by heavy night sweats and a deep, generalized sense of feeling unwell. Unlike most viral illnesses that typically clear up within about a week, the fever patterns tied to pancreatic cancer tend to linger for extended periods or keep coming back despite attempts to treat any presumed infection. Symptom 7. Extreme fatigue or physical weakness. Pancreatic cancer can drain your energy in profound and exhausting ways that go far beyond ordinary tiredness. This overwhelming fatigue feels like a deep, bone-weary exhaustion that refuses to lift no matter how much rest or sleep you manage to get. Cancer cells aggressively compete with healthy cells for vital nutrients and resources, leaving your body in a constant state of depletion that makes everyday tasks feel impossible. Simple activities you once did without thinking, such as climbing a flight of stairs, carrying groceries, or even getting dressed, can suddenly become completely overwhelming. The fatigue is frequently accompanied by emotional shifts, including feelings of depression, heightened anxiety, or a general sense of hopelessness. Sleep often becomes disrupted or unrefreshing, feeding into a vicious cycle where physical exhaustion worsens mental strain, and emotional distress makes rest even harder to achieve. Unlike normal tiredness that follows a predictable pattern of effort followed by recovery, cancer-related fatigue defies that rhythm entirely. You might go to bed early, sleep for a full 8 or 9 hours, and still wake up feeling just as drained as when you lay down. These energy crashes tend to creep in slowly over weeks or months, which makes them easy to dismiss or attribute to everyday stress, aging, busy schedules, or lack of exercise. Symptom 8. Digestive issues. Pancreatic cancer can seriously derail your entire digestive process through several different pathways at once. The pancreas is responsible for releasing key enzymes that break down fats, proteins, and carbohydrates so your body can absorb them properly. When a tumor interferes with enzyme production or blocks the pancreatic duct, a wide range of troubling digestive symptoms can emerge. Undigested food may linger in the stomach for too long, leading to persistent nausea, episodes of vomiting, and a constant feeling of abdominal discomfort. The connection between the pancreas and healthy digestion is intricate and essential. When it's disrupted, appetite often vanishes because the body struggles to process nutrients efficiently. This loss of appetite frequently results in unintended weight loss and eventual nutritional deficiencies that further weaken the body. One particularly telling change involves stool appearance and smell. Bowel movements may become unusually pale, greasy or oily looking, and carry a very foul, offensive odor. These characteristics occur because fats are no longer being adequately broken down and absorbed in the intestines. Recognizing these 8 potential warning signs of pancreatic cancer could make a life-changing difference by helping catch the disease at an earlier, more treatable stage. If this information has been helpful or eye-opening for you, please show your support by liking the video and subscribing to the channel. Your engagement helps us share vital health awareness with a much wider audience. Thank you for helping spread knowledge that could save lives.